have osteoarthritis of the thumb, it's probably very uncomfortable, it hurts your thumb, it might be swollen and limits the range of motion, and you've come to the right video. In this video, what we'll talk about is what is osteoarthritis of the thumb, what are the symptoms of it, as well as how do you treat osteoarthritis of the thumb. Before we get there, who am I? My name is Igor. I'm a personal trainer who specializes in helping people with arthritis get rid of their joint pain. So first, let's start with what is arthritis of the thumb. Simply, it is the wearing away of the cartilage either in this bone that connects the thumb to the wrist, or in this bone, which connects the top part of the thumb to the bottom part of the thumb. Or it could be both. Neither one is fine. And what are potential causes of osteoarthritis of the thumb? One potential cause is injury to this, to previous injury to here, which could have worn away some cartilage in and of itself. That's one potential cause. Another potential cause is using the thumb a lot for work. So if you're on a computer a lot, especially a computer where you have to use the mouse is around the thumb, that could wear away very, very quickly. These are two potential and very likely causes of thumb osteoarthritis. Now, what are some of the symptoms of it? One is, of course, pain. That's probably why you went to this video. Another one is growth. You'll see extra bumps around it. It's not a nice smooth texture. There are bumps growing out from there. Also, there might be swelling, there might be redness, and there might be puffiness. These are all symptoms of arthritis of the thumb. So how can you treat osteoarthritis of the thumb without medications? You could do the exercise route and you could do the supplements route. In terms of exercises, one of the most effective exercises is to pull my finger. And here's how you do that. This is actually called traction. You grab with your index and your thumb on the other side, you just pull it away. So you just create a little bit of force between this hand and you just pull with about 5 to 10 pounds of force for 30 seconds. You do that multiple times throughout the day. That's if your arthritis is in this joint. But if your arthritis is in this joint, you pull just a little bit higher up, same parameters. About 5 to 10 pounds of force, 30 seconds, multiple times throughout the day. That's called traction. Another effective exercise is strength training. Simply strengthen your thumb in different directions. So if you're trying to strengthen this part, you would resist the thumb against your hand and you would pull it in, just like so. Or you would pull it up, you would extend it the other way. Okay. Now, a major guideline for strength training with the thumb is don't do it if it hurts. In other words, if bringing it in hurts, don't do that at first. If bringing it out hurts, don't do that at first. Or find ranges of motion where it doesn't hurt. Maybe bringing it in at the end hurts, but the first, 100 degrees of motion are fine. So go ahead and do it in the pain-free range of motion. And you would do that somewhere between 10 15 times. For 2 to 3 sets spread throughout the day daily. That's another thing that's very effective. And a third form of exercise that's effective for osteoarthritis of the thumb is simple stretching. So not just traction, which isn't really stretching muscles, this is distracting joints. Stretching would be stretching this muscle or the muscle on the back of the thumb. The way you do that is you put your hand on the front side of the thumb and then you pull it back ever so gently until you feel a stretch at the muscle in the base of the thumb. You could also do the opposite. You could go here and reinforce it here until you feel a stretch on this part of the wrist. Okay, that's the exercise side of things. So again, number 1, traction, hold my finger. 2, strength training by resisting your thumb. And 3, stretching by doing the opposite. That's the exercise side of things. There are also supplements that are very effective for osteoarthritis of the thumb. Yes, glucosamine, chondroitin, and MSM have been used for decades, but they take a few months to work. If you want relief faster than that, you can use something called type 2 collagen. Add doses of 30 grams per day. A lot of women use collagen for hair, skin, and nails, and while that works, it's a different type of collagen. There are 5 types of collagen, and only type 2 collagen is found in cartilage, and that's the type you want. You want type 2. The one that's for hair, skin, and nails is type 3, and it won't work for thumb osteoarthritis. Okay. The other supplement that can be very effective for osteoarthritis is something called SAMe, S-A-M-E, which stands for S-adenosyl methionine. It's a very potent supplement that works on the brain, more so on the hand relief side of things, as opposed to the cartilage building side of things. If you can combine those two supplements with the exercise, you'll start to find relief from your osteoarthritis in a matter of 2 to 4 weeks. And the longer you do it, the better the function is going to be. If you like this video, subscribe, click like, and I hope you benefit.